Hey, what's going on, everybody? You seem to like the how to beat diabetic neuropathy video, so I thought that I would make one for my patients or my followers out there who have a chemo or radiation induced neuropathy. So let's go through this. Now, just because you've stopped chemotherapy or radiation therapy, just like we talk about with diabetes, it doesn't mean that there isn't damage there. The analogy that I use with diabetes is that if you set your house on fire and you put the fire out, there is still damage there. And that's why, just because you've stopped those therapies, it doesn't mean that the damage didn't happen. So when you're talking about how these chemotherapies work and these radiation therapies, what I find in my clinic is that it damages the microvasculature in the hands and the feet. I use this analogy all the time that if you get a paper cut and you restrict blood flow to that in a week, a month, a year, 5 years, it's not going to heal, right? It's going to not be able to get oxygen and nutrients to it. So while you don't really have to control your blood sugars, it is a good idea to control any inflammatory foods that you're eating, to control as much inflammation in your body. But this looks very similar to diabetic neuropathy. But you're going to use some way to increase blood flow. You're going to do this through nitric oxide supplements. You can use beetroot. You can use light therapy. You can use shockwave therapy. You can even use oxygen therapy, which these are kind of the main things that we use in my office or with my virtual patients. But those, you have to increase blood flow so that the body can heal. The next thing is typically we do some sort of electrical stim. We use supplements to regenerate the myelin sheath as well. And then the last thing is, like I said, just decreasing inflammation in your body. One thing that nobody ever thinks about when it comes to radiation therapy is that it could be 5, 10, 15, however many years down the road, and these patients will develop these neuropathies, and they're not diabetics, no surgeries. We rule out everything, even statin use. And what we typically find is, let's just take like Chernobyl for an example. While it's not that crazy or not that severe, that radiation that is there for a long time and it continues, it has a very long half-life, which just means that it degrades very slowly. There's a reason that people, when they're doing those procedures on you, are wearing lead vests, they're behind a lead wall, because those things will cause issues. And so when you're getting that for cancer treatment, that's going to be a lot of radiation to kill that. And while they say it's specific, it is not. While it can be more concentrated, it goes diffusely. It goes everywhere. So that's how radiation works. So, don't let them kind of fool you with that. But oncologists a lot of time don't know that these things can cause neuropathy. And that's what we see. And they just say, hey, here's a gabapentin, see you later. And, that's what they tell you. Like, well, you're probably they either tell you, oh, it'll go away, and it never does, or, you just got to learn to live with it, which we don't like settling for. I know you all don't like settling for. So hopefully this helps. If you have any questions, please just reach out to me. And I'm more than happy to help. I'm going to be doing some other videos. If you like this, please like it, share it. That way I know what you guys want to hear more of. And if this one does well, then what we'll do is I'll make another one for surgery. So if you want to hear about surgery-induced neuropathy and how to fix that, please like, comment, share. I really appreciate it. Thanks. See you all later. Bye.